Thank you for deciding to watch this video. Number 10 of our testing strategy, commonly tested topics. Like I say, I bring questions that I think like to come and those that I've heard from other people. So I put it together. This is a serious thing. Let's continue. The nurse is ready to administer prenatal vaccine for a client 24 weeks pregnant. Which of the following the nurse should question? The key fact about the question is you have a 34 weeks old pregnant is getting vaccination. Which one should you question? That means which one she cannot get. She's a pregnant lady. She's immunocompromised, so we should not give her a live vaccine. If you see a live vaccine here, it's wrong. HPV is a live vaccine. MMR is a live vaccine. Nasal influenza is a live vaccine. Varicella is a live vaccine. Those are the ones we should question. Tdap, she's able to get it. 2, 3, 4. Because they are not indicated. They are all live vaccine. A pregnant lady should have a live vaccine. And this is assessing client's allergy to vaccine. Which of the following the nurse should assess? So we want to know if you will be allergic to certain vaccines. What should we look for? QA is for latest allergy. Avocado, latest allergy. Neomycin, yeah, vaccine allergy. There's a component of vaccine. They use neomycin, they use gelatin and yeast. So gelatin, yeast, and neomycin. If you're allergic to that, you're more likely to be allergic to vaccine because they contain components of that, of those information. And this is assessing a client's allergy to vaccine. Which of the following the nurse should assess? The same thing. I'm cleaning so that I can add more information so that you can get familiar with them. The same thing. Kiwi, no. Avocado, no. Neomycin, gelatin, yeast, and then egg allergy. You should include it to that. Egg allergy, you have to check also. Some vaccine has neomycin, gelatin, yeast, and egg allergy. So I'm just trying to get you to understand that it's a good question they can ask you. Okay, a client with egg allergy asks the nurse if it is safe to obtain the influenza vaccine. This is always controversy about whether you are allergic to allergy. You cannot get flu vaccine. I intentionally said this question. So what is the next best response? You should avoid it. Yes, no, it's wrong. You can get the nasal flu, that's okay. You can get the IM, that's okay. But both of them is incomplete. You can get any of them. So we can choose nasal flu and IM flu. This is not a select or apply. And I said there is no contraindication. Therefore, that means a lot. When you say that, you can do whatever you want to do. So that's your answer number 4. And then she's teaching a client about colonoscopy procedure. Which of the following statements made by the client indicate correct understanding? So colonoscopy to look for polyps, right? I will need colon cleansing before the procedure, okay? I will avoid colored fluid during the preparation, okay? Abdominal distension and guarding is common. No, it's not common. Uncontrolled flatus post-procedure is common, okay? I will need an escort for the procedure, okay? So the only one that need intervention indicate correct understanding. What? I will need colon cleansing. I will avoid colored fluid, uncontrolled flatus, and I will need an escort. The one that is wrong is that one. Guarding is uncommon. So number 1, 2, 4, and 5 are your correct answers. And this is preparing the body of a client who passed away 1 hour ago. No autopsy requested. Which of the following actions by the nurse is appropriate? So which of these is appropriate? Keyword, passed away, just died. There's no autopsy. Therefore, I can do whatever I want to do in terms of what I can keep and what I cannot keep. A few of them is the dentures, right? Removing the dentures is bad. Even though there's no autopsy, you got to keep the dentures. Closing the eyes is good. Okay, keep the client in a supine position is not good. His face wall will be discolorized. So you got to raise his head up so that blood can drain down. Place a pad under the perineum. Okay. Allow the family to assist with the care. Good. So 1, 2, and then 4 are your right answers. And then number 7, quick question. And this is caring for a client post below knee amputation. Which of the following the nurse should include in the plan of care? So below knee amputation, we want to prevent contraction at the onset. So it's very important. Clean the limb with soap and water. That's good. Okay, elevate the limb daily. This is wrong. The first 24 hours, you're going to elevate it. After that, you don't need to elevate anymore. So that's number 2 is wrong. Assess the limb for skin breakdown. Yeah, you got to assess it. Avoid sitting in a long chair for more than an hour. Yes, because of the amputation. Prone position several times a day. This is to prevent contraction. And a range of motion exercise for strength. That's good. So that's the way the answers will look like. Number 8, the client is not taking digoxin for heart failure. Which of the following statement from the client needs immediate intervention? So you're taking digoxin, which one needs some further teaching or immediate intervention? I will ensure consistent potassium intake. Okay, you want to avoid hypocalcemia. I'll call my ophthalmology for any vision changes. No, you should not call them. Yellow vision change, it toxicity. You need to talk to your doctor. I will check my apical pulse before taking my medication. Okay. I will need to see my PCM to change nifedipine to another medication. Yeah, because I'm taking a calcium channel blocker. So nifedipine, which is a calcium channel blocker, you can take it while you're taking the digoxin. So it's bad. So the one that need immediate intervention is number 2. Color changes in your eye, need your primary care doctor, no ophthalmologist. And this is caring for a client with 45% total body surface area. Which of the following vaccine the nurse should inquire the status of? So the patient, the key is a little bit confusing the way it's framed. A 45-year-old total burn to the body. Which vaccine the nurse should inquire from the patient about, right? Anybody who get burned is more likely to get infection from the skin, like tetanus infection. Measles is not a problem. Influenza is always this guy. So the right answer, she need to inquire of what is the client's status of tetanus shots and how long is the last one. No, I think. And this is caring for clients. Which client have a choice the nurse should educate about when on digoxin. If you're on digoxin, you should avoid hypokalemia. You should avoid something related to your phosphorus, magnesium. You want to maintain them in the specific normal as much as possible. Locorice, it causes hypokalemia. So if it causes hypokalemia, we cannot use it. So because of hypokalemia, we have to question that, right? St. John's wort, it has nothing to do with the digoxin. Sorapomate is for BPH, and black cosh is for basically menopausal symptoms. Therefore, localized, which causes hypokalemia, should be the one we should be concerned about. But take care of yourself. Keep on charging as always. All the best of luck. Bye.